Hello, my people, and I did welcome to our very first anatomy lecture, the lecture of introduction to anatomy. Now, see, say, now we dey use take pop the champagne, take start the stuff, so make una try show una boy love. So to kick start the stuff now, we go get outline now. We go take things one by one. So we will get what is anatomy, the approaches to studying anatomy, the body, the parts of the body, the positions of the body, planes and terms. So now the stuffs we go treat be that. Now, as per Naija boys wey we be now, we go move straight to business. So what is anatomy? Anatomy is just basically the study of structure. As per you know am before, structure just wetin the body dey composed of, wetin be this, wetin be that, and wetin we go look at be that within the course of anatomy. And I'm sure you probably already know that. You look at physiology, it's quite different. Physiology is the study of the function of that structure. So that is the difference between anatomy and physiology. Shey una grab am? Straight up, we go move to the approaches wey dey use to study anatomy. We get the regional approach and we get the systemic approach. If you look at regional approach now, regional approach is an approach where you deal with the body in separate parts. The number one wey you dey take am in the first place, like the way you take know am since when you small, say you get stomach, you get chest, you get hand, you get leg, but we get some other different terms wey we dey use in anatomy to describe these regions. For example, we have the regions that we have the head, we have the neck, we have the thorax, we have the abdomen, we have the upper limb, the lower limb, and we have the pelvis and the perineum. So those are the regions that we have. You get it? So next up, we have the systemic approach. Systemic approach na im be the approach wey dey use in system format. If you remember your normal biology from secondary school, you go remember say dey get all those level of organization from cell to tissue, from tissue to organ, from organ to system. Now that system level where we get all those systems, digestive system, excretory system, respiratory system, and so on and so forth. Those are the systems that are treated together in the systemic approach. For example, now they will take the whole digestive system. They will start from mouth, continue go maybe esophagus, go actually pharynx and larynx dey ahead of that. From that to esophagus, from the esophagus to stomach. So they go dey treat all those things one by one. Na im the systemic approach dey based on. So next we move to positions of the body. If you look at the positions of the body, they are about like some fundamental ones like the anatomical position. Apart from the anatomical position, we have the fundamental position, the supine position, the prone position, and the lithotomy position. Now, you see, for the anatomical position, it is a position in which the body is erect. There is the eye going forward. Person just dey look straight. The upper limbs, that's the hands, they dey by the side of the body. Fingers, they point downwards. They point straight down. Like your fingers just dey point straight down. The lower limb, they dey parallel to one another, meaning say everything just dey straight, just dey, and the toes dey face front. So na so anatomical position dey. So that's for the anatomical position. We have the fundamental position. Now, if you notice something about the anatomical position, you will notice that everything was like a normal natural posture, except that the hands, you just force yourself, turn them to the side, so they fit dey face lateral. So that your thumbs can face laterally. But in the fundamental position, the hand just dey relaxed by the side of the body. So that's the difference between the anatomical position and the fundamental position. We also have the supine position, where the person is lying on his back. So person just dey lie down on top him back, na im be supine position. Prone position, person dey lie down on top him chest. So guys, we also have lithotomy position. It's a position where the person is like reclined on their back, and like the thighs are spread, the leg that is at the knee joint, there is flexion at the knee joint. That's the person don't bend the knee. The person does the feet of the person they planted on the ground. So that is basically how the lithotomy position is. That is the usually so done with women during delivery and stuff like that. We have planes in anatomy as the next thing to look at. The anatomical planes are like five. There are a few of them. We have mid sagittal plane, we have sagittal plane, we get coronal plane to transverse plane and oblique plane. So
if you look at the first one, mid sagittal plane is a plane that is found in the median position. Like now, let me tell you about it. We have, if we take a person like this, we just carry sword, cut am into two through the center, that's following the mid sagittal plane. You just face the person for front, cut am with sword, dey cut the person for mid sagittal plane. Then we get sagittal plane. Sagittal plane is any plane wey just dey along that line, wey dey parallel. E just dey parallel to the mid sagittal plane. That's beside the mid sagittal plane. Mid sagittal plane go dey for center. Any other cut wey you cut the person from front, from up to down, na also sagittal, not mid sagittal. You see mid now, that mid dey talk about middle. Then we get coronal plane. Coronal plane na im be the one wey you go turn go the person side, go cut am for side, like but from up to down still. So that's coronal plane. We get transverse plane where you dey cut the person, like straight, this horizontal line na, you just cut person for horizontal line. Like let's say you just go the person stomach, just cut am. You fit cut am at any point sha. That's the transverse plane. Then we get oblique plane, which is any plane wey no be any of these four planes wey we don call so far, na oblique plane e be. Oblique just mean something wey be say like the line no be horizontal line, no be vertical line. Na just line wey no dey horizontal and wey no dey vertical. So now those are the anatomical planes that we have. Now to continue, we have anatomical terms. What are these anatomical terms? Now we have the other ones, like we have anterior and posterior. Let us see anterior and posterior. Anterior is talking about what is in front. A in anterior now, e dey talk about front. Then for posterior, P go dey back of A now. So posterior dey back. That's for anterior and posterior. Then we have ventral and dorsal. Ventral and dorsal. So for ventral is kind of synonymous to anterior. So ventral go dey front, dorsal go dey back. So that's so anterior and posterior and ventral and dorsal resemble themselves. Then we get superior and inferior. Superior up, inferior down. We dey like when they tell us about inferiority complex, and if person dey feel superior, dey feel on top. Dey feel on top, na im be superior. Then inferior, person dey feel down, you get, just dey down. So superior up, inferior down. We get central and peripheral. Central, something wey dey center na, you suppose get that one. So peripheral, e dey for edge, e dey for edge. That means say e no dey center, e dey for edge. Na im be central and peripheral. Then we get some four like that wey dey come in bunch. That's intermediate, median, medial and lateral. So if you first look at median among all of them, median means say e dey center. Median means say e dey center, meaning say e dey that center line, e dey along mid sagittal plane wey we just talk about not too long ago. E dey for mid sagittal plane, that's median. Then we have medial. Medial is close to the mid sagittal plane. That is means that it is closer to median. Medial is closer to median. Then we have lateral, which is away from the median, meaning say away from medial and median. That is lateral. And then we have intermediate, between medial and lateral. That means say between wetin close to center and wetin far from center, we get intermediate. So na so the stuff dey. We get external and internal too. External and internal. External you suppose know say na outside, internal na inside. Okay. Now we get superficial and we get deep. Superficial means say something dey by surface, e dey for surface, while deep means say e dey inside. So that is superficial and deep. Similar to central and peripheral. So we get cranial and rostral and caudal. Cranial and rostral means similar something. They are the same thing. Cranial and rostral means say something dey up towards the head side, while caudal means say e dey down towards tail side, or if you wan put am with normal broken, for close to leg or close to tail. So that's cranial and rostral is for close to head. Caudal is close to tail. Then we have ipsilateral and contralateral. Ipsilateral means the same side, something wey dey the same side. If I say carry your right hand and the ipsilateral leg come, e mean say I dey tell you say make you carry your right hand and your right leg come. If I tell you say contralateral, contralateral means opposite side. If I say carry your right hand and the contralateral leg come, it means say make you carry your right hand and the left leg come. You get am? All na just things wey dey use joins laymen. So we get proximal and distal. Proximal is talking about something wey dey close to, while distal means something wey dey far away from. They dey use this term when they dey talk about limbs. Limbs, you hear what I say? Limbs, upper limb and lower limb. So proximal go dey closer to the body, the trunk. Trunk, you hear what I say? Trunk. That's where we have thorax and abdomen. So while distal is away from the proximal part. You know, say your limb sef na joint separate them. We will get there one day. Let's go. We have flexion and extension. Flexion and extension. This is in regards to joints. Flexion is when you bend something, you see now you no go straight again. Like let's say you just carry your elbow now, you just flex am, you just bend am, you just give you angle like that. Na im be flex. You dey see am for the screen. Then we get extension is the one that is what? When you straighten the limb, you just straight am. That one na im be extension. E dey for your screen. Abduction and adduction. Abduction, if you abduct something like you carry am run away, dey abduct person, dey carry am run away. So abduction is to move the limb away from the body, away from the body. That's away from the median plane. While adduction is towards the median plane. Abduction away, adduction towards.
Regarding rotation, we have two types. That is medial rotation and lateral rotation. Medial rotation is rotation inwards. Lateral rotation is rotation outside. So medial rotation bend inside, lateral rotation bend outside. While circumduction is just rotation. You get. Next, we have supination and pronation, where supination na im be the one wey be say person palm, that is if we are talking about the hand, go dey face up, while pronation is e dey face down. So if something dey face up, it is supinated, and if it is facing down, it is pronated. Na wetin supination and pronation dey about be that.
Then we get inversion and eversion. Inversion na im be make something bend towards the median plane, while eversion e dey bend away from the median plane. Then we get protraction and retraction. E dey like if I wan punch for somebody now, I go just protract my hand, my hand go just go front. If I don finish dey punch am now, I go bring my hand back with retraction. You get am? So now we have elevation and depression. If you say elevation mean something dey up, mean something move up. Then if you say depression mean something go down. You sabi depression for real life now. The same person dey depressed, the person don dey feel down. Then elevation, if you say dey elevate somebody, dey rise am up now. So na the same thing for anatomy.
Thanks for watching, guys. I really appreciate so much. And please try to like and subscribe before leaving the channel. Thank you very much and have a good day.